Now, the minority is lashing out at government over its decision to impose a double tax on vehicle owners, describing the move as obnoxious and unnecessary. Government's carbon emission tax took effect today, requiring an annual payment of at least 75 cedis for carbon dioxide equivalent emissions on internal combustion engine vehicles. The levy is part of the government's commitment to address greenhouse gas emissions and promote eco-friendly technology. More of that shortly. First, here is a news desk report on what the levy is all about.
Rapid climate change in recent years has become a global concern as the United Nations continues to encourage countries to take actions to address the menace. Ghana, in a bold but controversial move to combat the escalating threat of climate change, has introduced an emissions levy after Parliament passed the Emissions Levy Act in December last year. Government says the levy is aimed at discouraging the use of carbon dioxide emitting internal combustion engine vehicles. While discouraging the use of combustion engine vehicles, the levy is to promote the use of eco-friendly technology such as electric cars. Unbeknownst to many, the levy does not only affect the transport industry, but many other sectors. According to the Act, the levy will affect the construction, manufacturing, mining, oil and gas, and electricity and heating sectors. How much are the affected sectors expected to pay? For the vehicles category, motorcycles and tricycles are expected to pay 75 cedis per annum. Motor vehicles, buses, and coaches up to 3,000 cubic centimeters will pay 150 cedis per annum. Motor vehicles, buses, and coaches above 3,000 cubic centimeters will pay 300 cedis per annum. Cargo trucks and articulated trucks are expected to pay 300 cedis per year. For the remaining sectors such as construction, manufacturing, mining, among others, they are expected to pay 100 cedis per ton of emission per month. The new levy takes effect today, February 2024. Despite the justification given by government, tax expert Francis Timoboy believes this levy is a revenue measure rather than an environmental objective.
I think that it is more of a revenue measure than the environmental objective. Why am I saying that? Environmental tax or carbon tax is supposed to discourage or have a direct effect on behavior. So if you say that you want people to shy away from fossil fuel, that's petrol, diesel cars, then they should shift to an alternative. The question is, the alternative that we are being offered here is electric vehicles. Is it within our reach? The answer is complete no.
We also hit the streets to find out what Ghanaians think about the levy. Here are their views.
We need engineers on this issue. The government could have engaged the ordinary citizens on this as well. What would the levy be used for?
Tax. Drivers won't be too fair. Yeah, passengers there. We are passenger. We need say bia. What I say? Because almost facing difficulties.
We as passengers have little to say on this issue because we have no choice. We can only plead with the government to reduce the taxes and levies.
So what I say? And there's almost a too fair anymore. Yeah, yes, can come, but also, and I'm saying here on it is scanning what they but now say quantum, and also what one was him here on to bed, but I'm so back. And I ban the yesterday say, Onion near Mamu, on good near Mamu Mai. So I live, no, I too much. Oh, by ya surrounded cry. Just say, near my, I'd be near ye, dear, Tarash be beer, your tutumu, I know high.
Semefa Rejoice and Kwesi Adai Kwarteng's report for Joy News.
But Minority Member on the Finance Committee, John Jinapor, says the plethora of taxes government keeps piling will end up making the cost of doing business in the country unbearable for entrepreneurs.
First of all, government is being dishonest with the people of Ghana. This tax has nothing to do with emissions. If you look at the emissions table, Ghana is nowhere near the emissions table. Indeed, Ghana contributes less than 1%, even within sub-Saharan Africa. So this idea that they are fighting emissions is a non-starter. The honest truth is that they have signed on to an IMF conditionality which compels government to raise the threshold of the revenue as a percentage of GDP to a certain level. And so they are looking at every means to tax the people of Ghana. We're already paying pollution levy. What has that money been used for? What is the difference between pollution and emissions? It is these emissions that causes pollution. So how can you charge the people of Ghana pollution levy and then turn around and charge them again for emissions levy? That's a duplicity of taxes. What it is certainly going to do is to increase the cost of living, because you should expect transport operators, especially commercial operators, to pass on this cost to consumers. Ultimately, what this will do is that by and large, with the plethora of taxes that this government is heaping on Ghanaians, it will make the Ghanaian entrepreneur uncompetitive. It will make our products very, very expensive. It will affect our exports, and ultimately it will impact negatively on the growth of the Ghanaian economy. I find these pollution and emission levies obnoxious. They are unnecessary, because even with the pollution levies, they have not been applied in respect of their intended purpose.
Now, transport operators are already asking government to put the implementation of the tax on hold to allow for stakeholder engagement on it. Deputy PRO for the Ghana Private Road Transport Union, GPRTU, Samuel Amwa, says they will factor the taxes in the computation of transport fare increment proposal to government.
The taxes we are paying is not enough to take care of those things. Why can't you call with the stakeholders or the public to educate them, to tell them that, hey, these taxes you are paying is not enough to take care of these things?
Did you get a response to your petition? Did you get a response to the petition you sent to the Ministry of Finance and GRA?
No, not yet. We've not gotten any response. That is why we came out with a 20%, a proposed 20% increment of our transport fare. And then the ministry called us to put a hold on it till we had a roundtable discussion before we come out.
And that roundtable discussion has yet to start? That roundtable discussion has yet to come on?
Yes, it's yet to come. So I remember the last time we met, the minister asked us to go back and draw or do our calculation as to how come we came about that 20% transport fare increment. Even what we did earlier on, the emission tax wasn't passed. So this time around, what has happened now, it means that we need to fall back, go back to our calculations, then insert the emission, tax percentage in it. Then we can also present to the Transport Ministry about our proposed, transport fare increment.
Meanwhile, Associate Professor of Environmental and Nutritional Epidemiology, Professor Kofi Amega, is asking whether the implementation of the levy will effectively reduce emissions or if it's merely intended for revenue collection purposes. He spoke with Elton Brobe on the Pulse.
This levy in itself, how is it going to cut back on emissions? I mean, I'm an epidemiologist, and of course, the health impact from these emissions are great. I mean, if we start, we're not going to end today. But are we taking the levy just for the sake of collecting a levy? Or is it a punitive measure such that vehicle owners will soon realize that, hey, listen, I'm paying 300 Ghana cedis a year because my vehicle is smoking, so I need to switch to electric vehicle. I need to go and buy a brand new car with very good emission ratings. Are we taking this money such that at the end of the year, I overheard you say government seeks to raise over 500 million Ghana cedis annually. That is huge. That is huge. How much, what percentage of this money is going to go into improve air quality in the landscape of Ghana? Well, I don't know. We are bereft of air pollution data. And these emissions have particulates, they have nitrogen dioxide, which are polluting our landscape and then causing hazard to our health.
We'll surely come to the health implications.
Yeah, we'll come back to that. Yeah. I'm just raising some of these issues.
Right.
So I mean, how is this the $500 million, how is it going to be spent? How is it going to help improve our health quality? How is it going to help to mitigate climate change? You know, because if you say I should pay 75 cedis per year, I mean, I'll pay it, but then I'm still polluting.
Well, I read from the Tertiary Education Workers Union, University Senior Staff Association of Public Universities and Sister Labor Unions strike is in full force now. Now, these unions are asking government to make sure that their Tier 2 pensions are paid. Now, for labor unions, the University Senior Staff Association of Public Universities in Ghana, Tertiary Education Workers Union, TEWU, Ghana Association of University Administrators, and the Federation of University Senior Staff have all laid down their tools over claims of poor working conditions and non-payment of their pension. According to the unions, government is yet to remit all Tier 2 pension deductions made over the past 9 months to the private fund managers. A situation they say is affecting members, especially those who are due for retirement. A meeting between government and the unions to resolve the matter just came to a close as the unions say government has not been able to give any assurance when the monies will be paid. My colleague Kenneth Jesse has been on the beat all day and filed this following report.
Despite meeting the Finance Ministry and the Education Ministry today, the Senior Staff Association of Ghana, the Federation of University Senior Staff Association of Ghana, and the Teachers and Educational Workers Union say their strike still holds. They say their meeting with the ministries ended with proposals given by government, and they say they will not return to work until their demands are met.
Today has been a very tough day, difficult and stressful day for us. Yes, we went to this meeting with a position, and we know our position. Government is owing us our Tier 2 pension, and we are requesting for the payment of the principal plus 3% penalty per month. And when they spoke with us, we've given them our proposal. They said they are going to consider and they'll get back to us. So we are waiting. When they get back, then we take a decision from there. That's what happens today.
So does that mean that you put your strike on hold?
No, our strike is still on.
Strike continues to bite hard. On the University of Ghana campus, heaps of garbage are seen around the entire campus with nobody to collect them. Students complain it is affecting them.
Due to the strike, the facilities are not well maintained. An example is the JQB block, where one of our lecture halls. So last week morning, the whole place was full of water because those who were to take care of the place were not available to maybe clean the water for us to be able to work, to go to class. So this makes people very late to class, and the rubbish outside is overflowing. You can see rubbish everywhere, and it makes the school look very nasty. And under the tree where the benches are, people are sitting there, but there are rubbish around them, and it makes it very bad.
Also, we're supposed to have lectures this morning, but then because the place has been used as an examination room, we're unable to go for lectures there, and we had our classes held online this morning. And it is going to return back after they are done with the examinations.
Before their meeting with government, the striking union did indicate that if government does not come to a consensus with them, their strike continues unabated, and truly they stayed to their words. From the Ministry of Education in Accra, Kenneth Jesse for JoyNews.
Let's take you to the Central Region, where students who visited campuses for various academic reasons have been left stranded with no staff to attend to them.
My name is Bafo Esther. I'm from Sunyane. Some of my colleagues are from Wa, Cape Coast, Accra. Please, we have been here since yesterday. We are here to collect our certificates, but there is no one to assist us over here. So we are pleading with the government to give them whatever that they need, so that we can get our certificate.
My name is Barry Issa Mohammed. I'm from Fafra, a distant student of UCC. Actually, I came to take my certificate today, my degree certificate today. But then when we came to campus, everything seems to work fine because from the onset, they did everything perfectly fine. No one told us something was going on. So after we cleared ourselves and then we did everything necessary we are supposed to do, coming to take our certificate and then we were told that they are on strike. So right now we are so frustrated and then we don't know what to do. Information reaching me is that some people were even here since yesterday. They had to sleep on campus just to make sure something would happen today. But unfortunately for all of us, nothing has happened. And then right now as we speak, we are stranded and then we don't know what. Some of us are actually coming from work. Some of us from Accra, like I already mentioned. And then some of us are working and then they had to take permission from their bosses just to come here. But then coming to see this situation is very frustrating.
We woke up one morning to a news of strike by the senior staff and table of the various institutions, which UCC itself was affected. Our students, as we are affected by this great strike, when it comes to the university hospital, which serves not just the students' body, but the whole total, the community within UCC.
In Kumasi, students of the Kwame Nkrumah University of Science and Technology and Apia Menka University have been left stranded on campus as they were denied access to some facilities on the first day of the Tertiary Education Workers Union of Ghana strike. My colleague Nana Boachi Yadom monitored the situation and as far as this report.
Unfortunately,
The university's library, maintenance and lecture theatres are among the affected departments on various campuses. The industrial action has affected academic activities, leaving students perturbed. National President Suleiman Abdurrahman tells JoyNews a task force has been put in place to ensure total compliance.
We are going to make sure that we have task force across all the university campuses. We have local leaders across all the public universities. So they will make sure that they put in place the task force to make sure that they monitor for everybody to comply with the strike action.
The strike is already biting hard as students are denied access to the university's library and lecture halls, which remain closed following the indefinite industrial action.
We got here and we've seen that the place is locked. I didn't hear of the strike though, but as I can see, we are now sitting here without being able to enter. So I think the government should try intervene and meet their standards or meet their needs for them.
We came to do group discussion, but as the library is locked, it affects us so much, and we beg and plead the government to call off this strike because with the students it affects us the most.
Well, what are you doing after here?
So we are now going to find some place for it because we have to submit it on Monday.
So you are coming to do your group assignment?
Yes.
So you are group. These are your group members?
Yes, they are my group members.
So where do you have to go now to study?
No, we don't know. We don't know, but our leader was saying we have some room here, but we don't know. So we don't know what to do right now.
President of the Tewu Ghana KNUST, Charles Arthur, is happy with the impact of the strike. According to him, the management of public universities will be forced to shut down the university.
We are saying that in the near few days, the environment will not be conducive for students to attend lectures. That we do not close the university. It's the management of the university that closed the university when it has become ungovernable, when something has happened and they think that it should go. But we know that withdrawing our services, you understand, will reach there.
Xavier Sali Agbleke is the president of Tewu Ghana Amstead.
We want them to come to heed to our concerns so that the whole balloon about the school student welfare should not be as if we are all parents, you know. We cannot let our children suffer whilst we are taking charges, taking control of everything in the campuses, then neglecting them on concern. You see, so we wish the government to come to our aid, to see to whatever demands we are making, to sit down with us, then restrictions out amicably.
For JoyNews, Nana Boachi Yadom, Kumasi.
Now, the health minister has ordered a comprehensive audit of all health facilities across the country, responding promptly to the recent JoyNews series titled Sick Hospitals. The investigative report exposed the deteriorating conditions of health facilities in urgent need of rehabilitation. Our investigations revealed alarming issues such as leaking roofs, extensive cracks compromising the structural integrity of buildings, and lack of essential equipment, and many facilities deemed beyond repair, requiring immediate attention. We'll hear from the Health Ministry soon. First, let me take you to the Efiankwanta Regional Hospital in the Western region, which lacks a defibrillator, leaving health workers there distressed.
A defibrillator is the life-saving equipment. When the heart is not beating normally, the defibrillator is used to deliver controlled electric shock to the heart. This shock can help restore the heart's normal rhythm in cases of sudden cardiac arrest. In countries like South Korea and the UK, defibrillators can be found in public places like pubs, markets, and crowded places. What about Ghana? The Ghana Harmonized Health Facility Assessment Report 2023 says only 5% of hospitals in Ghana have the required basic equipment in consulting rooms. We make our way to Ghana's oil city. Takrady Inter-Regional Hospital receives referrals from across the region. It is fair to say that it serves over 3 million population. Apart from cardiopulmonary resuscitation, CPR, which involves chest compressions and rescue breaths, can the hospital save your life if you go into cardiac arrest?
I would say that we're doing the best that we can under the circumstances. At the A&E, where you are most likely to be taken to, we have just one defibrillator, but for a unit of that size, we should have more. So in your case, if you are the only one who needs the machine at that point in time, yes, we will be able to do it for you. But if there are many patients who need the same service, then it becomes a challenge.
Dr. Joseph Kojo-Tambil, the medical superintendent of the hospital, is passionate. He wants his medical staff to get the best equipment to serve patients. But he also wears another hat to manage the information he gives the media, and also assure residents of the Western region and beyond that they can rely on his facility.
Well, in response to these staggering revelations, PR of the Health Minister, Isaac Ofeiban, revealed that the minister has tasked the Structural Directorate to audit all health facilities and produce a report.
When you look at this particular structure, when this issue gets to the Honorable Minister or the Ministry, the Infrastructure Directorate was compelled to go and have access so that we are able to know the cost involved. Some of these structures that you are looking at, if you have to take the cost of maintenance, it will give you a new hospital straight away. So these are some of the challenges that we are putting in place so that we address them. You talk about maintenance, where you need to put a new facility. When you look at what we have now, if we have to invest money into maintaining it, into bringing it back to life, it will rather be good that we have a new facility instead of going back to maintain some of these things.
Did I hear you say and clarify that the ministry is conducting a facilities audit across the country?
Yes. Some of these issues came up, and the Infrastructure Director is being tasked by the Honorable Minister that is to assess all these facilities that are having these challenges. And like I said,
what's the goal? What's the goal there? What's the objective of this?
When you have them, the objective of the survey is to inform you about the amount of money you need into forming up a budget that will be able to take care of some of these things. One, like I said earlier, we are looking at renovation. We are looking at rehabilitation. But some demand new hospitals instead of this rehabilitation.
A public health fellow with the Center for Democratic Development, Kwame Sapon-Siedu, believes the ministry directive is a knee-jerk reaction that will not yield much results. He spoke with Evans Mensah on PMS Press.
Say la ilaha illallah. Hear people talk like that. I realize that they lack the gravitas to even speak on health. I mean, sometimes I need to call a spade a spade. I have to say that's a test based on the data. You presented me with a report. The report is clear on the needs of the country. I also have the luxury of the last budget presented by the finance minister, where there is no line when it comes to biomedical, maintenance of our health equipment. You are dealing with a situation whereby health is a public service good. It is a human resource right and has to be delivered. It is not being delivered because the facilities are sick. You have a harmonization report that is telling you what the problems are. And you tell me the answer is Agenda 111.
Okay, so apart from that, he says, though, that there has been a directive from the minister to their facilities department to travel across the country, do an audit, to come back and give them a picture of the state of these hospitals, what it will cost, then they can go and fix them.
This is where I get animated. Let him go and read his own holistic assessment of the health program of health works report. That is a report, that is a statutory document, and that is why I keep saying, you know the problem with Ghana? Our politicians know the best way to treat us is to put the truth in plain sight. If you go into the holistic assessment of health programs of works report, he wouldn't be saying the sort of things he's saying. When I hear people talk like this, I realize they lack an understanding of the statistics when it comes to running health. We even bring in equipment. We don't sign contracts that would ensure they are maintained. And we are building new hospitals, and we go and commit the same crimes again.
Now, General Secretary of the Ghana Medical Association, Dr. Richard Selome, says the situation is widespread, with many of these hospitals now becoming death traps to many healthcare officers across the country.
Unfortunately, it's not an isolated incident across the country. We have seen this across various aspects, even in the capital city itself, with complaints about Kolebu, the surgical block. We have seen various facilities across the country. So it's not really an isolated issue across the country.
How bad is it across the country?
Well, I cannot put a figure to it, but what I can say is that even if it is one place that is bad, for which translates into loss of lives and then also decrease in the quality of care that can be given, as well as delays in care, and then general decrease in the confidence that we have in the health system, that is bad enough.
This is still JoyNews Prime. We'll take a quick break. We'll be back with more. Please do stay. Welcome back from the break. Now, health officials at the 37 military hospital are calling on the government to strengthen and restore social welfare institutions in the country to provide for persons who need help and support. This follows the difficulty in identifying the family of a man believed to be in his 30s who was knocked down by a vehicle on the motorway, becoming the burden on the hospital in the process. The ward in charge of the neurosurgical ward of the hospital, Major Emmanuel Intifo, believes a well-functioning social welfare system could cater for people like Apia. There is more in the following report.
The middle-aged man is only identified as Apia and is believed to be in his early 30s. He was admitted to the emergency unit of the 37 military hospital in November 2023 by a Good Samaritan after he was knocked down by a speeding vehicle on the Accra-Tema motorway. All attempts by the hospital authorities to reach the family has proven futile. The ward in charge of the neurosurgical ward of the hospital, Major Emmanuel Intifo, says doctors and nurses in the hospital are left with no option than to take care of him from their own pockets.
The person who brought him initially was cooperating, but along the line decided not to follow up anymore. So we've been able to take care of him till a point that he was ready to go home. There wasn't anybody coming. So through our command and then through our Department of Public Relations, we were able to send a picture of his to the social media, and then people started coming. Then we had a friend of his who finally showed up and then mentioned his name. So before then, or before now, he was known as Unknown Monday. But when the friend showed up, he was able to tell that he's called Apia, and that was all that the friend could give. He was able to tell us that he knew him from Koforidua and knew some of the relatives at Koforidua, so he will make you do follow-up for us. He did the follow-up, and then unfortunately, it came out that the relatives that he knew that were at Koforidua, they had relocated, and he didn't know where they have relocated to. So currently, we are looking at ways of getting him a permanent place.
Major Emmanuel Nsefo called on government to strengthen and resource social welfare institutions in the country to provide for persons like Apia.
He is okay to go, but where is he going to? So if we had a function or a well-organized social welfare agency that is able to take care of some of these victims, I think it will go a very long way. As he's lying here, he's occupying a bed that someone who is in an acute state or who is an emergency state will need. But because he is on that bed, we can't bring another person who needs it most than he does. So if we're able to get organizations, if we're able to get government institutions that are well-equipped, well-resourced, it's not just the institutions, but well-equipped and well-resourced to handle some of these cases, it will lessen the burden on the ward and equally give other people the opportunity to survive if there are spaces here to admit them.
President of the Accident Victims Support Ghana, Reverend Cyril Crab, leading the group to make a donation of items, including toiletries and consumables, advocated for more support for accident victims.
It's something we've set out to do, and we have been doing over the years. It's a decade and more. And so coming here today is one of the things that we feel the joy to do anywhere, any day, anytime. But notable of them that we want the country to know is that we've looked far from these people already. Crash victims I'm talking about, we've looked far from them. It's just like any other disease that can kill. The moment you set out on the road and you are in a car and you set on the road riding to your workplace, have it in mind that casualty is part of it. If you are out of it, then the Lord has been good to you. But when you fall prey to it, which of course it can happen to everybody, let's try as much as possible to come around and then help these people. Especially in this month of February, we think that we should set the pace. If there is any kind of love we should show to these crash victims.
Major Nsefo expressed gratitude to the Accident Victim Support Ghana for the donation.
Almost everything that we do for him comes from contributions that we do as staff, and then other benevolent persons and then groups. If they hear about him and it touches them, they come along with some of the personal items that he will need. Because being here, he will wear diapers, he will drink water, he will eat. There are some basic things that he cannot be denied of. And definitely if relatives were around, they would have provided those things. And since relatives are not around, then we as staff of the ward have to take it upon ourselves. So we do a lot of contributions. So the Accident Victim Support Organization coming in to bless us or bless him with these items, it will go a very long way in the care that we will give to him whilst he's still with us. So the very good time that he will leave us and go to another place.
With Apia responding to treatment, authorities of the hospital are encouraging anyone with information which can help identify the family of Apia to reach out to the hospital. Prince Kwame Kudoge's report for Joy News.
Now, the National Health Insurance Scheme subscribers still paying out of pocket for services they receive at the country's health facilities. The NHIS was established more than 20 years ago by law to provide equitable access and financial coverage for basic health care services to Ghanaian citizens. But latest demographic and health survey report released by the Ghana Statistical Service shows that even though the NHIS remains the most patronized health insurance scheme, subscribers are always forced to pay out of pocket for various services at the health facilities. Now, what really does this mean, and what are the teething challenges that need to be overcome? Ranking member on the Parliament's Health Committee, Minta Kando, joins us with more. Grateful to you for joining us. Now, what's your reaction to this once you've heard that this is what it is?
Hello, can you hear me?
Yes, I can hear you, sir.
I think it's a self-inflicted challenge or problem And I don't think government must pretend not to know the solution of the problem that we are facing with regards to this particular incident. First and foremost, there are two main factors here. One is the delay in the payment of claims. Okay, sometimes government delays in payment of the claims facilities in excess of 3, 4, 5, 6 months. And you know, in our country, our currency keeps depreciating at, a very steep rate. And then we also have a very, high inflation rate. So the delay in the payment of the claims is one of the factors. Then again, there's the fact that government is, or the National Health Insurance Scheme is not paying what we call realistic tariffs. And I'll give you an example. For example, if a service provider goes to buy a paracetamol syrup, and they buy it at less than 5 Ghana cedis per the tariff by the National Health Insurance, they are giving the provider 4 Ghana cedis. So they have only two options: whether you do a top-up, or they will say they don't have that particular drug is not available. So these are the factors, and we know, and this is as a result of the fact that the money or the levies we take in the name of the National Health Insurance levy, government itself caps the levy. And that's one, so I'll give you an example. For example, in 2024 budget, government will tell you they are going to raise about 5 billion Ghana cedis for the National Health Insurance Scheme. But they are going to release only 3 billion Ghana cedis for expenditure of the National Health Insurance Scheme. What it means is that government has capped over 2 billion Ghana cedis. So these are the challenges. Not until we decide not to cut the National Health Insurance and pay related tariffs, we're going to continue to have these challenges.
But this do happen, we talk about it, nothing really changes. So how do we handle this situation? How do we ensure that the real changes that we're looking up to do happen?
I think I have been talking about this on countless occasions. Countless occasions. So not until government itself takes a decision that we are going to declare the National Health Insurance Scheme, we will face these challenges. And so the ball is squarely, in the court of government. We have been raising the alarm, we've been drawing government attention that it is insensitive to cap any health institution in this country. It is insensitive. It is government's responsibility to invest rather in these health facilities. And so, I don't know. I just watched one of your news items. You titled it "Sick Hospitals." And these things, I don't understand why we are pretending as though this is the first time we are here. It's so widespread in the country. And we've been speaking about this all the time. Why would you see this when the internally generated funds by the district hospitals or the hospitals in the country are collected at the central point? The director, what they call Ministry of Health, and the Ghana Health Service. You are taking the internally generated funds back. So what would they use to maintain the hospitals at the various districts and the regions?
Okay.
These are the problems. So the only thing you have been able to identify the sick hospitals, but you have not been able to identify the people who take the policy, the sick policy makers. You have not been able to identify those ones. And it is important we identify those ones as well.
Okay. All right. Thank you so much for joining us here. Now to other stories. The outgoing Chief of Defense Staff, Vice Admiral Seth Amwama, has urged leaders to exhibit good leadership in their work. Now, he also stated that leadership is not about the rank one occupies, but lifts the life they impact. Mr. Seth Amwama also charged warrant officers to abide by instructions of their commanders. There's more in this report.
Fellow armed forces. Fellow armed forces.
After over 40 years of service to the Ghana Armed Forces, a pull-out ceremony was held to mark the retirement of the outgoing Chief of Defense Staff, Vice Admiral Seth Amwama. The outgoing Chief of Defense Staff joined the Ghana Armed Forces in the year 1981 and has served in many roles. He was later appointed in 2021 as the Chief of Defense Staff. Vice Admiral Seth Amwama charged commissioned officers to always show good leadership and professionalism in their work.
I charge
all commission officers to continue to show leadership in their work. Leadership in their work. There is a quotation on leadership I like so much, and that quotation is at page 10 of your program. And I quote that leadership is not about the rank you hold. Leadership is not about the rank you hold. It's about the lives you touch and the legacies you leave. In service, we find purpose, but in leadership, we inspire greatness, unquote. And so, officers, I implore you to be committed to your leadership responsibility and be professional in our dealings. In my view, professionalism essentially means training all year round to improve our skills. Such training provides us with the essential leverage in mission accomplishment.
At the same event, he also stated that leadership is not about the rank you hold, but the lives you impact. He also charged warrant officers to always follow the commands of their superiors.
I also urge the warrant officers and senior NCOs who are the backbone of the military to translate the intentions of commanders into actions. And then to the soldiers, the sailors, and airmen, I urge you to learn, work, and train hard to carry out all orders and tasks to the best of your abilities. That way, our armed forces can continue to stay focused and effectively deal with the myriads of threats that confront our nation.
Elikem Day's report read to you. Ewa sang for a total of 31 hours from December 27 to 28 to become the first